Hello, everybody. Welcome to another episode of Find Your Model Health, the official podcast for those looking to optimize their long-term health and weight goals and understand how their body really works. I am your host. I'm Shemaine Linney. I'm a fitness and nutrition expert, certified iridologist, and biohacker. I'm very happy to have you all back with me for another piece of your day. And today we have on the loveliest guests, Rebecca, who has been a friend of mine, or I've known you since 2016, 2017, I think.
2017, yeah, January 2017.
Quite a while. So Rebecca is a local business owner, and she's going to discuss basically why she started this new local business and the services that she's offered. But before Rebecca comes on, I just want to give you a bit of her background. Rebecca has been a nurse for over 10 years who started working and continued working in and for advocating for women's health. After working in the fertility and reproductive health field for 8 years, she decided to start a women's clinic offering services which included advanced technology because, as I understand, you felt that was going to be the next step for us. And this then helped her provide accessible healthcare and offer mobile blood collections and even IVs and bring hopefully everyone closer to the answers they're looking for. So Rebecca, welcome. Let's hear a little bit about your background. Of course, you're based in Airdrie, Alberta. For anyone who is curious, when I say local, we are Airdrie, Alberta.
Yes, hi. So yeah, like you said, I've been a nurse for a very long time now, it seems. And my passion has always been helping others. And then after I graduated, I went directly into working in labor delivery postpartum. And from there, went right into private healthcare. I worked in fertility clinics, helped run fertility clinics, and I realized that there's just such a gap in knowledge and support in the community for women about our hormones, about how our bodies function, how each woman and individual is quite different. We're not all just estrogen dominant running around. Some of us are more testosterone. Some of us have more thyroid-based problems. You're the expert on that. You know how controlling our thyroid can be. And I wanted to do more. I wanted to educate on that level of how to ask your physician for these tests and how we should know more about how our bodies and our hormones are working. We shouldn't have to wait to find out once we become symptomatic. And then I realized I could do more. The opportunity came to me to bring in advanced technology into my clinic. And what I can do now is help women correct their diastasis recti with abdominal contractions in correlation with proper gym techniques and balance. I can also help women with menopausal symptoms that suffer from dryness, hormonal imbalances, women that can't go on estrogen supplements because they have blood clotting disorders, or there are other places that they can't, or other reasons they can't do that. So I can heat that tissue, bring blood circulation back to the tissue, and help your body reproduce these things on its own in a more natural way.
So you have, and we're going to get into the services a little bit more. So we've over the years, myself and yourself, we've spoken a lot about like the reproductive system, female health, fertility, a lot of conversations around cervical issues. And I remember saying to you at the beginning of my own cervical issues, I remember being so angry that there was no women's clinic in Airdrie, that I had to travel all the way into the northwest of Calgary to get tested and checked for what I wanted to check. I was so angry over that. So I know that's not fully in the range of what you're doing, but I'm happy to see a woman's health clinic open, and God knows where you're going to go, because I know you're passionate and driven. So you never know, you may be able to offer what I needed back then eventually. But so you opened Vena Mobile Health, which now you also have a location just off Main Street in Airdrie. So tell us, how did that happen? What is Vena Health?
So I started off with another company. I was contracting with them, and I really liked the bridge they were building in our healthcare system, accessibility, being able to bring healthcare to you versus you now having to drop everything to access healthcare. We live in a nice environment per se that we can walk into a physician's office and speak to a physician, and that's nice to be not have to pay an arm and a leg for that. But then we're giving up a lot on the other side of it. Our time. We're now sitting in a crowded office. We're giving up a lot. So I wanted to bring that into Airdrie. I wanted to be able to provide accessible blood work. So your physician's ordering you blood tests and you don't want to take half day off of your work, or you don't want to drag your kids around to the labs with you, or you're only available on weekends, but the labs are closed. So I wanted to bring that into action. So I started off doing that and then growing more towards what else can I bring into your home? What else can I make more accessible? And then I got into IV therapies, which I found very interesting in regards to what we're able to put into our bodies into a direct system versus a digestive system. So supplements orally versus supplements directly into our bloodstream. How effective are they? What does that look like? I did courses on that, and I loved the idea of the IV therapy. I had a surgery in April of last year, and as soon as I got home, I had an IV therapy. At my 3-week follow-up, my surgeon was surprised how well I was healing the tissue. It was an adult tonsillectomy, so brutal. It was horrific. Do not recommend. But it was good because it helps lower that inflammation quicker. It helps the tissue regenerate on a cellular level. And that's what I wanted. How can we make that effective and efficient, growing and making our cells healthy? So that was the mobile aspect of my business. But my passion for women's health is still strong. So I was presented with an opportunity to bring in a machine for advanced technology, and I went for it. I just took a leap of faith and decided, okay, I need a brick and mortar. I need a place for women to be able to come in. We'll talk about their issues. We'll talk about concerns, and let's see what we can do. And so here I am.
Yeah, and that's just off Main Street, kind of how would I even describe it? Just kind of around where Good Life and Safeway and all is, if people were looking, one of the side roads there.
Yeah, like if you know where PharmaSave is and the store upstairs, right across the street from that, there's Raymond Spa, and then Anna's Spa, Anna's Day Spa, I think it is, the Hair Lounge, and I'm right beside there.
The reason I recognized it because they used to have an immigration officer there in that building. I don't know if he or she is still there, but they did. I never went to them, but obviously as an immigrant, I kind of take note of certain things. Yeah. So I knew that little building, and it's an adorable little building too, probably one of the nicer looking ones.
Yeah, it's a heritage building, so it's full of character. I love it.
So what services now are you offering out of your location?
So out of the location, I offer pelvic health, strengthening. We strengthen your floor internally and externally. We can help correct diastasis recti, help build core strength. We can also do aesthetic appearance. So we have the Morpheus 8, which goes up to 3 to 5 millimeters into your skin, injects radio frequency. So it's pretty much we call it re-education, neuromuscular re-education and collagen production. So we're reteaching your body to produce its own collagen and elastin. It's on the moderately invasive scale in regards to downtime and recovery. It takes about 30 full days to see the results of your treatment. Treatment is usually 30 days. And you're numbed through it all, so you very minor discomfort through that whole period. But what I loved about it is that it's naturally producing collagen and elastin. You're not injecting toxins or fillers into your body. We can do that internally as well, which seems very intimidating. But what that's doing again is that it's injecting that radio frequency, causing little micro injuries then as we know, that's going to tell our bodies to heal. And as we heal, we're going to inject collagen and elastin and build that vaginal wall, that tissue stronger. And it's, again, then going to provide your pelvic floor the support it needs, because as we age, our muscles, our tissue, everything's becoming atrophic, drier, thinner, fragile. So that's just helping boost internally. And then we have the electric muscle stimulators, which are a V-tone. So it goes internally into your vagina and it will pulsate and it'll cause that involuntary contraction of your pelvic floor. So you are doing superhuman Kegels. You're not having somebody reach up there and manually manipulate your pelvic floor. So I always tell the ladies that come in that this is a wonderful addition to your day-to-day healthy lifestyle. This will not take over, but it is a fantastic addition to seeing a pelvic floor therapist, going to the gym, being more healthy. These are great support systems for that. So those are some of the services I offer. I do have another platform that can help with menopausal symptoms. So again, we're bringing blood flow and circulation to that tissue. It helps increase sexual sensation, which some of the ladies are quite enjoying. And it also helps tighten that labia and more aesthetic appearance of the vagina as well.
Well, I was going to ask, do any of these help to tighten the vaginal canal to make things tighter? Because as we get older and we have kids, things get looser. So does that help tightening, which then encourages not just the sensation for you, but also for your partner as well?
Yeah, exactly. So we would want to go in and use the V-tone for that, because you're getting not only the benefit of rebuilding and strengthening your pelvic floor, but you're also building that vaginal canal, that strength all around, especially that what we call the introitus, right? So that's just that opening of our vagina there. We want to make sure that that's getting tighter as well, because that helps keep everything uplifted and snug.
Can this help with incontinence as well?
Yes, that's the main focus, is helping with incontinence. A lot of, I mean, I've had patients come through that are as young as 25. I've had patients come through that are well into their 80s. And we all, in some way or another, while we have had vaginal deliveries or even C-sections, or even we've had any type of trauma, anything like that, or we just have a weaker abdominal core, that can also affect our bladder and our pelvis and how we can hold our urine or not. So all of these are based upon helping incontinence.
Would you say it would be beneficial for someone with interstitial cystitis?
I would say yes, if we went into, depending on other systemic things that are happening. So we can do the Morpheus 8V, which would then do those micro injuries with the radio frequency to help lower that inflammation and heal healthier.
Yeah, because I know I have a couple of clients that do have interstitial cystitis and even incontinence for young women in their 30s, which is an inconvenience and embarrassing at times, especially if you go somewhere like flying squirrel and you're jumping on a trampoline. Like,
yes.
You want to be prepared for that.
Yeah.
So then just to go back to, is it the Morpheus? That's what it's called? That's not, just to clarify, and you correct me if I'm wrong, it's not actually an injection, it's not a needle, it's sending radio frequency through your skin, because I wanted to be clear, it's not actually injections.
So it's 24 gold-plated micro needles. So there are 24 needles that will go in.
Okay.
They are, when they're going in, they are allowing that radio frequency, that heat, to then penetrate the deep tissue.
Kind of like, it would be kind of like microdermabrasion or something like that.
Yeah, times like a million.
Have you compared, so a lot of women, because I follow your Instagram page as well, a lot of women are using it for more the aesthetic appearance aspect of things. You've got several videos on there showing how it's performed on your face if anyone wants to check it out. So you can see they get the numbing cream on, and I'm assuming most women come back to kind of regenerate the facial tissue, help with wrinkles, plumpness, that glow and moistness that we all want. Is that why most women would be going to get that done?
Typically, yes. Because the results of these treatments last between 1 to 2 years, the upfront investment and having those results make that worth it versus going every other month or every couple of months. You're doing this because your body can now naturally produce its collagen and elastin for that length of time. I always suggest if women are coming in for anti-aging purposes or aesthetic purposes that the ball's in their court. We do the 3 months, we get those initial 3 treatments in there, allow that body to adjust to that production. And then once they get to a point where they want a little bit more, or they're noticing wrinkles in different places, then they can come in and do a maintenance treatment, we say. Mostly, and why this attachment was brought into this platform was for stretch marks, scar tissues, helping deplete that cellulite that we can have under there, because that heat, that radio frequency will break that up for you. In that sense. It is nice because it does do a little bit of tightening, a little bit of lifting, and we all love that. It's natural, but for this clinic and this purpose, it was designed for stretch marks and loose skin tightening.
So for whatever it is that you want, you're saying it's a minimum of 3 months, which would be 1 session per month to start to see results. Like 1 session, you're not going to see a lot of results, but those 3, you should start really seeing the results. And then you could decide, oh, I really like this, I want to do more or whatever.
So you will see results probably within the first week post your treatment, once the redness is settled and your skin is now rejuvenated. You can't see that, but it does take a full 30 days, about 4 weeks for that healing process to complete. And then you come in for your second treatment, and each time you will see the benefits and progress. And then I have clients that also come in that want to treat active acne. And I've treated lichen sclerosis, which is that connective tissue. It's kind of sheeny, looks like scar tissue. I've had women that come in because they have chronic yeast infections, UTIs. We can treat those. We can help with outside skin inflammation.
How young will you do the acne for? Obviously, a lot of young girls now dealing with acne. And if this was a safer option than going on some sort of medication, like this would be ideal.
Yeah, so it depends on the parent. From 13 and on is completely fine, because at that age, especially in girls, not so much boys, but especially with girls, they're more attentive to they care about their cleanliness and maintenance, and so it makes that investment worth it for them. And then we do have a medical grade skincare line that we did bring into the clinic to help supplement that. So it really just penetrates that skin.
You have 2 girls and I have 2 boys, and I've always spoke to, oh my God, they're so gross. I don't even know where the smell comes from. I don't know how it happens. The house will smell great in the morning, and then as soon as I go downstairs and open like the basement door, it's like, what happened here? How does that even happen? Like, so yeah, boys a little bit grosser than girls.
Yeah, I think girls are pretty gross until they get to a point where they start caring about the look. I know that smell is a big thing. Oh, I can't smell. I have to shower 5 times a day. And so 13 is probably a good age where you can consider making that investment for your daughters.
That's what in Ireland, my mom and my aunties and all used to say that was the age where we would start smelling ourselves. And it was like a metaphor for paying attention to how we looked. Oh, look, she started to smell herself now. I don't know where they even
I love that. It makes sense. Like a couple men come through the clinic that have also had just scarring from acne. And I've had clients that have been on Accutane and strong products to help with those breakouts. And with women, sometimes the bottom line is that it's not just because you produce extra oil, it's because of your hormones. There's always going to be an underlying option. You can't superficially treat that until you treat what's going on inside. So I'm very transparent with my clients. Yes, I run a business, but forefront, I am a nurse, I'm a medical provider, and that's where I find people are trusting me and building this.
Mm-hmm. And you mentioned stretch marks. Obviously, you know my journey. Everyone knows, I think, I lost a lot of weight. So I do have stretch marks. What kind of results have you seen? And then I have another question, actually, that I wanted to ask. But the stretch marks first, because they don't bother me as much. They've improved a lot, obviously, with my nutrition and lifestyle. But they're still there. If I could make them go away, it would be nice.
Yes. So I've seen great results, actually. Depending on the depth of the stretch mark, of course, will distinguish how many treatments you would want to get for your optimal results. It's definitely individually based because your stretch marks and how you view them are for you. It's your body. So you decide, yeah, I'm okay with just one treatment. I feel good about that. Or, oh yeah, no, I would like to go for a second and a third. And then we talk about that. I go, okay, well, based on the depth of the stretch mark, the scar tissue that's there, it may take 3 sessions for you to see a result, or it may just take 1.
Mm-hmm.
I was being trained on this machine. I had one of my girlfriends come in. She had a 4-month-old baby, her second baby, and she had stretch marks. They weren't too crazy. They were pretty superficial, but again, they were there. Within 24 hours, she sent me her picture and you could barely see them.
That's awesome. That's really cool. So my next question then was going to be around loose skin. I know a lot of women going for tummy tucks, actually, trying to get rid of this loose skin. I have loose skin because I lost a lot of weight, but I also have not delicate skin, but my skin has got a weaker constitution, so I have to take care of it a lot. But a tummy tuck wouldn't be for me because it would put me out of commission for too long, and then that wouldn't be worth it. So I'm always looking at other alternatives for the loose skin aspect, and it's something that comes up a lot when I'm working with clients. When they are losing weight, they start to get concerned, like, am I going to have loads of loose skin at the end of this? So what does the Morpheus do around the loose skin? Can it help there?
Yeah, so again, it depends on the grade of the loose skin. Where is it located? If there's quite a bit of loose skin, the Morpheus can help a little bit with that. But if it's a little bit of loose skin on your stomach, I have loose skin on my stomach after I had my girls. It's always been a bit of an insecurity of mine. And then I will be going through my own Morpheus journey, which I'll document. It'll be hopefully cool to see what that's going to be like for me. I know that based on other results I've seen from other practitioners that use Morpheus on loose skin, they've had great results. So I'm excited to see how it goes.
Mine would definitely be worse than yours. I know mine is a lot worse than yours, but I'll watch and see, because even a small improvement, there's just one area that I would like an improvement there. I mean, it's not a big deal. It's not like I'm going around in bikinis or anything, but it just, for me, it would be nice. The big thing that bothers me is the loose skin under my arms. Even though everyone else says they can't see it, I see it. So that's the biggest thing for me. And to even get that skin cut off, then I wouldn't be able to work out for 12 to 16 weeks. I would go catabolic. I'd probably get depressed. I'd lose a lot of muscle and strength. The pros and the cons, it's just not worth it for me to do that. So anyway, I digress there. Tell us a little bit about the IVs then. And this is mobile as well. So people don't just have to go into the clinic to get these IVs.
Yeah. So we do balance between mobile and coming into the clinic. It really is dependent on who you are and what you want to do and what you can do, what's your lifestyle like. Our IVs, of course, there's that, everybody thinks that the IV therapy is for hangover cures, which is not, no. Yeah, you can definitely replenish those electrolytes, aminos, and vitamins, and your body will thank you for that. We do have an IV bag that does have a painkiller in it now that is directed for migraines and hangovers. But what I love about the IV therapies is that they are jam-packed full of amazing vitamins, electrolytes, and amino acids. Currently we have one bag, which is our most popular. It's called the immune bag, and it will help boost that immunity again on a cellular level, keep the inflammation in your body at a lower state. So when you are faced with getting a cold or any type of virus that's out there, your body has what it needs to help fight it more effectively and efficiently, where it's not going to take you out as long. It's not by any means a cure. It's not going to prevent you from getting sick, but it is a direct route into your body, into your bloodstream, that will help absorb everything that you need.
So what you're saying is that the IVs are not a cop-out to go get smashed every weekend and then get an IV. But if someone wants to do that, Rebecca is not going to say no to your money. So that's totally up to you. And that's me saying that, not Rebecca. So all liability can come back on me. So how many different IVs do you have?
Currently, we have 4. So we have the immunity one, we have a energy boost one, which is a dextrose-based bag. So if you're diabetic or suffer with any type of insulin, then that wouldn't be recommended for you, because what it's designed to do is give your cells and your body an instant boost with that dextrose that's in it. So it gives you an instant boost into your cells. It's designed for athletes and people that are very active, helps replenish that lost energy level. It's great for, again, it has lots of electrolytes and aminos in there, and it's good for people in general that are feeling a little bit more sluggish and are looking for that extra pick-me-up, that extra boost. We do have our third one would be the hydration boost, which is the one that most people are looking for when they are feeling extra dehydrated. And that is the one that we can also add the painkiller into for any migraines and headaches. Its sole purpose is to help replenish and correct, the dehydration. They all will, because they're all in 500 mils of solution, except for the energy. Everything else is in normal saline. So you're going to get hydrated.
How effective have you seen the hydration one for migraines? That's a topic I've been covering the last 2 weeks. So how effective is that?
Before we were adding in the painkiller, it wasn't an instant response. It wasn't, oh, I feel the instant relief. It was helpful for that minor migraine, but those ones where it's just pounding, you're nauseous, you need to be in complete darkness, those ones, it needs more. You need a little bit more to take that edge off so your body can heal and lower that inflammation.
Is that just electrolytes and the painkiller, or is there magnesium as well in that, or what?
There's magnesium in there, yeah.
Do you know what form of magnesium it is?
I actually have it right here. I can. It just states, it's just a generalized one. I can go into my account, but it just states magnesium on there.
No, that's okay. That's just me being anal, always wanting to know the details. There's a lot of people suffering with migraines, so that interested me when you said that, because I had no idea. We hadn't spoke about that before. Yeah. So then my next question is, if someone did wake up with a migraine this morning or feels a migraine come on, then I suppose the question would be, well, how soon could they get in to do something like this if this was something they wanted? I know schedule kind of, but do you have an average kind of time frame?
Typically, if you're feeling your migraine is coming on, just call in right away and see if there's availability for us to come to you. I do have a couple other medical professionals that I contract. So if I'm not available, if I'm in the clinic and I'm booked up, then I can see if somebody else can go in there. But usually, yeah, with at least within 24 hours, we can be available. And if it's an evening, great. Obviously, ideally, as soon as you're feeling that migraine come on, you want to start hydrating on your own and getting what you can until we can get to you.
Have you, now that we're speaking about this, have you used any of your other products to help with muscle tension around the traps or the shoulders and neck that may be a cause for people to have migraines?
I haven't. Like in regards to heat or
Yeah, in regards to stimulating relaxation and releasing that tension and tightness out of the muscles. I mean, heat could do that for sure.
yeah, no, I haven't, but we could probably talk more about that and see if there is something because I do suffer from the tension headaches, which then often lead to a day or two that I just have a pounding headache. So
Yeah, definitely something to consider if the heat waves and the frequency could relax the muscles. I have a couple of clients that faint. One of my clients has syncope. So a lot of that is contributed to that tension around the traps and the neck and the nape of the neck. And Botox can be beneficial for that because it'll relax the muscles. But if you could relax it through heat and frequency stimulation, that would be awesome, because you would probably be surprised the amount of people that have reached out to me over the last 2 weeks because I've been speaking mostly about headaches and migraines. It's a lot. I was blown away to know some people just live with it every day, all day. Like, I'm like, I don't know how you're even surviving at this rate. So as many options as possible, like is what we're hoping to give people so they can try different things and find hopefully that one thing that's going to work for them.
Yeah. And then not have to worry about injecting toxins in that way either.
And we, for a while now, I've contracted you to collect blood for me should my clients want blood collected. So Rebecca can do that if you get either a requisition through your doctor or you have a nurse practitioner that can help with that as well. Should people need to, then they don't have to queue up at, I don't even go there, the blood clinic to get collect. And sometimes it's so uncomfortable, and the white lights and the jackets and the environment. Just having someone come to your house and take your blood, you've got the requisition, take my blood, I'm still in the comfort of my own home, I'm not feeling uncomfortable, there's nobody looking at me, and queuing for hours is like my pet peeve. That would be hell for me. Queuing for eternity, that would be hell. You wouldn't even need to torture me. I hate queuing. So to have you do that in someone's home is so handy, because I'm sure I'm not the only one, especially after the last 2 years. People would rather be left to themselves to have something like that done.
Yeah, and I've had clients call me saying, hey, I'm pretty busy at work, but I really need to get this done. Can you come down to my office and get my blood drawn for me? Yeah, absolutely, not a problem. So it's a really versatile service. Again, I've had moms and dads reach out to me saying, listen, my child has a lot of anxiety. Could you try and come to my house? And this is kind of our last hope. And so I'm always up for trying. Anybody under the age of 12 has to be seen through public health or through a lab. That's just our standard. That's Alberta standard. But even, 12, 13-year-olds I've drawn blood with, just because, again, nobody likes to go to the lab. I'm a medical professional. I'm a nurse. I don't want to sit there. My time means a lot to me. And I don't want to sit in a room full of people that also don't want to be there, that also are not feeling well. We're all there for a reason.
Yeah. That whole environment, even if you don't have white coat syndrome, you will in that environment. I don't, but I just get tense and aggravated. I would rather not do that. And for the price, it's like what, $45 for collection? I mean, that's very reasonable for most people to not have to leave their house. So even like for elderly people, if anyone watching this, if you have a mom or a dad or an elderly relative and you know they're a bit too sickly to go out and get blood taken, this is an option for you as well. Or to the contrary, if you have someone in the house that's like so unwell, but you want to get their blood drawn to see what could be happening, then this is an option for people.
Yeah, exactly. It's accessible healthcare.
Yeah. So, which is great, which is why I wanted to talk to you, because I think this is amazing. And I hope to see you evolve into other areas of women's health that can offer like that full kind of even gynecological aspect of things for a women's clinic, because we are desperately missing that in Airdrie. You cannot see a gynecologist in Airdrie, which is ridiculous for a population of almost 100,000.
Yeah.
Not to mention like the surrounding areas of Carstairs and what that would come down to Airdrie if we had this sort of option.
Exactly. It is, like I said, the more and more I dive deep into women's health and more research as a woman who's had their own cervical issues myself, I've had kids, I have incontinence. It's like, oh, well, now you have to wait months to get into pelvic health, or now you have to go every 6 months and get a biopsy done, or now, but you have to go into Calgary to get this done, and you have to wait. Oh, we're booking out months in advance. Oh, there's like, huh?
I know.
Like, why is this happening?
Yeah. Oh, there's a waiting list. You're not going to get seen until maybe July. Well, I'm sick with symptoms right now. Whereas if there was a women's clinic, even if it was private here, look, I'm willing to pay privately to go in and get tested for whatever this itch or whatever might be. I will pay privately just to save the time. Like it's insane.
Yeah.
So before we tell people where to find you, this has been awesome. And I really hope that this brings awareness to our community, because a lot of people I don't think know about your new offering and your new location. So before we go on to that, Rebecca is offering 15% off to all of my clients who go in and let her know that you're my client. So 15% off all services, but she will be double checking with me that you are actually a client of mine. So don't try to pull one over on any of us. So 15% is very generous. Thank you, Rebecca. There's also another offer which Rebecca will tell us about to get a further discount. So why don't you go ahead and tell us that, Rebecca?
So if you subscribe to our newsletter every month, you will automatically get 20% off, and you follow along our journey. It's 20% off any service once a month. So if you want to use it towards a Morpheus treatment, you get 20% off that every month if you're paying by month. Or if you are a client of Shemaine's, then you do get that extra 15% off when you come in. And if you want an IV therapy, or if you want your blood drawn, you do get those added benefits.
That is a lot. That's 35%. People take advantage of this. So where can people find your newsletter, sign up, and follow you? Where can they find out more about you? And of course, your address, because we're kind of winging it a little bit.
You're very close. So to find us, we are on Instagram under Vena Mobile Health. You can follow us through there. We're on Facebook. You can go right to our website, which is venamobilehealth.com. And when you're on there, you can link to subscribe automatically through the newsletter. And then you'll get that no matter what. If you come in for a service, you'll already have your email engaged and you can sign up for the newsletter. That's how you get those discounts. You'll be updated on any of the new things that are coming in, any changes that are being made. And the address is 117 First Street Northwest in Airdrie.
Awesome. So I just noticed there, you say Vena, but I say Vena. And obviously that's my accent, but I didn't know that, because you should have corrected me ages ago.
Well, it's your accent. And honestly, it's Vena because it's Latin for vein. And as I started my business based on blood work and IV therapy, so it's Vena. And then I branched into Vena Women's Health and Wellness, and I have these now. So you're not the first person to pronounce it. It's not a personal thing.
Yeah, I was probably thinking Venus for vein, like the vein. So that's how I pronounce it. Also, everyone, if you're on my website and you go on the testing tab, there's a link to Vena's or Rebecca's website there if you're going to my website as well, so you can get to her there. And yeah, and you also have a Facebook page. I know you're not too active there, but you do have a Facebook page, because a lot of my followers are on Facebook more so than Instagram.
Yep, and everything that's updated on our Instagram page does automatically go into Facebook, so they coexist. So if you're more partial to Facebook, you're not missing anything.
I won't even tell. I'll tell you in private what I say about Facebook and Instagram. Okay.
Yes.
Well, thank you for spending some of your time. Everyone, check out Rebecca's stuff. I really think this is a valuable tool, and it's local. And then me and Rebecca, we're happy to converse. If there is an issue, you're a client of mine going to see Rebecca or vice versa, and you just need that whole kind of package where we can converse, me and Rebecca are in touch regularly, so we can go over kind of tips and tricks and helpful ideas to help you out as well. So thank you so much, Rebecca. Is there anything else you'd like to say before I let you go?
That's it. There's lots of events coming up in the community this year, especially in April. There is the lifestyle show at Genesis Place, end of April. I will have a booth there. So if there's anybody who wants to come meet me face to face, that's where I'll be at that time. I think it's April 29th and 30th are the days. So you can learn more about the business, or again, just feel free to reach out. I'm happy to talk and discuss anything.
I might pop by. I never usually go to that, but if you're going to be there, I might pop by.
Yeah.
Okay, thank you so much, Rebecca, for your time, and we will chat again soon, and maybe have you back on the future if you evolve into the deeper aspects of women's health.
Absolutely. Thank you so much.
Thank you. Bye.